Hello, nurse family. Welcome to another episode of Shift Report. I'm so excited about this episode because I know it's about a topic that's so important and interesting to everyone. On this episode, we're going to talk about all the important things you need to know to be successful on the NCLEX. And we're going to be reviewing the NCSBN COVID-19 guidelines. So I just checked again this morning. These guidelines are currently good through September 30th, 2020. So if you happen to watch this video after September 30th, 2020, be sure to visit the NCSBN website and check to see if anything has changed. Okay, so stay tuned. So before I start, I'm really excited to announce that I have 3 guests lined up for the next few episodes of Shift Report, okay? So I want to tell you a little bit about them so that if you have any questions or comments, things that you want me to ask them when I'm interviewing them, please go ahead and write those in the comment box. My first guest is a good friend of mine. I worked with her in the intensive care unit for several years. We actually started working at the same time as nurses. We got hired in the same hospital at the same time. And so we've been good friends for 12 years. She's going to come on the show and answer questions about her journey through nursing, how it was to transition from one career in healthcare to the next. The next guest that I'm going to have is also a really good friend of mine, and I worked with her in the intensive care unit as well. We met in the intensive care unit, and she's going to talk about working through COVID-19, dealing with, the mental effects that has on a nurse, and also how she's coping with it. And lastly, but definitely not least, is my good friend Nadine, who is a nurse practitioner in the NICU. So she's going to talk to us about her journey in the NICU as an RN and how it was to transition to an NP. So I'm really excited about my first 3 guests. They're all really good friends of mine. A lot of my friends are going to be on the show because most of my friends are nurses and they all have amazing careers. They inspire me every day. So those will be my 3 guests, the first 3 guests. So go ahead and write a comment or question down below and I'll be sure to ask them. Okay. All right. So let's get started. So the first thing I want to remind you that I'm going to first talk about the guidelines for 2020 and the changes that they've made to the NCLEX. Okay, so the NCLEX, when I took them a few years ago, used to be the least amount of questions that you would get are 75 questions. And the most amount of questions you would get are 265 questions, okay? And it is a computer adaptive test. It's a CAT test. So basically what that means is, and I'm sure many of you already know this, is that as you answer a question correctly, it's going to give you a higher level question, okay? Now, as you answer a question incorrectly, it's going to give you a lower level question, but it's also going to give you more questions in that area, in that topic, okay? Because it's trying to feel out to see if you understand this topic. So typically the test is going back and forth doing this, more difficult, less difficult, depending on how you answer the questions, so that it can gauge if you are safe to go out into the real world and work as a nurse, okay? So what they have done now, 15 of those 75 questions are usually research questions, meaning, when we write test questions, first of all, writing test questions is very challenging because you want to make it a good test question, not too easy, not too hard. So what the NCSBN does typically is that they'll put out these questions as feeler questions for research and to see how they perform on the NCLEX. And they do an item analysis to review those questions and see how they perform. And then they decide as a team if they're going to use the questions or not. Now, for the 2020 COVID-19 guidelines, they have decided to remove those 15 research questions, which now brings you to a minimum of 60 questions. Okay, so you can now pass the NCLEX in 60 questions, which is amazing. Okay. The most amount of questions you can have, the max amount of questions that you can have is 130. Now, I have to say, just because you finished the 60 questions doesn't mean you pass. Just because you finished the 60 questions doesn't mean you failed. So typically, If you did pass, that means that you already passed the threshold of amount of questions that you needed to get correct for them to determine that you are safe to practice as an RN. Now, if you failed at 60 questions, then you do really need to go back and study, look at the way you studied, and work really hard to find a different way of studying, because that means that you got enough questions wrong for them to determine that even at 130 questions, there was no way that you could have passed the test. Okay. Now, I don't want you to feel bad about that. A lot of times it's just the way you studied. Okay. Because you went to school, you finished school, your school passed you. They said that you were ready to take the NCLEX. So what you need to do is just think about how you're studying, and we're going to talk about that next. Okay. Now, the same goes for 130. If you get 130 questions, doesn't necessarily mean you passed or failed. Okay, so it depends. It means that you are getting questions wrong, questions right, questions wrong, questions right, and so that the test was trying to figure out whether or not you were safe to practice as an RN. Okay, now, ideally, you want to pass at 60 questions. Everybody does, right? Who wants to sit there for 130 questions? No one. But at the end of the day, as long as you pass and you get your RN license, it's what matters, okay? But what I want to talk to you about today is how to train yourself to be able to sit through 130 questions if you have to, which 130 seems like nothing now when I think about. So one of my friends was there for 6 hours. She took 265 questions. She answered 265 questions and she passed. So, but that's exhausting. That would be exhausting. The next thing I want to tell you is that you have the max time is now 4 hours, less time, because of COVID-19, they're trying to move people in and out and they don't want people staying for a long time. Now, if you do have testing accommodations, they will accommodate you. Obviously, you'll have to go through the same channels that you usually do to request those testing modifications. So go ahead and visit the NCSBN website for that. You will get extra time if you need it. If you're a person who always needs extra time, when you take an exam and you request that in school, you probably already have that documentation. So you go ahead and present that to them and you will be granted the extra time. Okay. The next thing is obvious. You have to wear a mask. Okay. I didn't see anything about gloves. I know some places require masks and gloves. I didn't see it. I might have just missed it. So go ahead and look at the site again. But I did not see anything about gloves. But I did see that you will not be allowed in without a mask, okay? The other thing that they said is that if your ID expired, if your license expired, that they will accept other forms of identification, okay? Like a passport and things like that. Because I know some people may have expired during COVID. They haven't been able to renew. I think a lot of places are open now. So hopefully you've been able to renew your IDs and get them up to date. But they are accepting other forms. So once again, I'm going to tell you again, know your resources, go back to that website and just make sure that your form of ID is proper. You do not want to get there and not have the right identification. Okay. All right. So the next thing I want to talk about. So now I kind of want to talk about how to prepare for the NCLEX. Okay. So when you graduate, your school is going to go through all your paperwork and your files, and they are going to send the requested information to the state in which you live, and you're going to take the NCLEX, okay? So after that, and that usually on a good, it used to take about a month and a half. I don't know what it's taking now. I think one of my students said it did take about a month and a half for her. So it's taking about the same amount of time. So a month and a half now that things are opening back up, and you'll get your ATT number, okay? That's your authorization to test number. Now, even if you do not feel ready to take the test, go online as soon as you get your ATT number and register for your test. Go to your Pearson VUE website and register for your test, okay? You can register for a few weeks out, a month out, whatever it is that you feel that you need. However, you want to go ahead and register because the sites are booking fast. There's a lot of restrictions. We also don't know if things are going to close back up eventually. So you want to go ahead and schedule that test, and you want to take it sooner than later. Now, I will tell you, research shows that you should not wait longer than 3 months to take your test. Some of my students, because they're doing HESI all the time, because they're taking all these exams all the time, From the moment they graduate, they feel they're ready. So as soon as they get their ATT number, they go and take their test. But I know other schools don't provide all of those computer adaptive testing to practice. And so maybe you don't feel as ready. Okay. So take a month, take 2 months, take 3 months, but do not take longer than 3 months from graduation. So I watched a couple videos where people were talking about going on vacation, and that's common. People graduate from nursing school and the first thing they want to do is go on vacation. That is a big mistake. Do not do that. Okay. Focus on your NCLEX. Your brain is still in school mode, right? You've been used to sitting down and studying for hours at a time. Continue that. I always love to say this, but don't go popping bottles too early, okay? Get yourself all relaxed. Guess what? When you get back, it's going to be hard to get back into it. You're going to have to refocus your mind to studying. You're not going to want to do it. So soon as you finish school, start practicing for your NCLEX, getting ready to receive that ATT number so that when you receive it, you can register for your test. Once you register for your test and you know you're going to take your test on this day, schedule your vacation for the week after. Okay. Now that could be a celebratory vacation, or it could be, a vacation that's meant to help lift you up when you're the most down. That's enough about that. How to practice. So the best way to study for the NCLEX is to practice NCLEX style questions. There's really no other way. You could sit there and read your textbook all day, know all the information, know the diseases inside and out. It's not going to help you. What you need to do is practice NCLEX style questions every single day. Okay. So already you've gotten yourself used to practicing 25 questions a day. That's great. Tomorrow, add 25 more. Do 50 questions in one sitting. Okay. Now, if you do 10 questions here, now you're in Instagram, you're on YouTube. If you're on YouTube, make sure you watch my videos. You're on YouTube, you're watching movies, you're taking care of your kids, you're doing this, you're doing that. Guess what? It's good. You practice, you learn the knowledge, right? You learn something. You probably learned something for the day. However, what you're not doing is training your mind to sit there and focus just on 50 questions at a time. So when you get to your NCLEX and you're anxious and you're nervous and you're sitting there, it's going to be very challenging for you to sit there and focus on 50 questions at a time. You should be used to this now because you've been taking test in school. That's why I say you want to take your NCLEX as soon as you can, because your brain is used to it. But you'll be surprised how quickly your brain is just like wants nothing to do with sitting down and answering 50 questions at one time. Okay. So I will tell you just my personal experience. I started at 25. I did 50. I did 75. But I maybe did 100 questions in one sitting, maybe once or twice. And when I got to the NCLEX, I was tired around 40 questions. So around 40 questions, I started to feel like I wasn't answering the questions all the way because I was just dying for the test to finish. I just kept thinking in my mind, oh, I hope it finishes at 75. I hope it finishes at 75. That's not a good thing. Okay. So thankfully, I was lucky. I did finish at 75. But I know that if I had to go past 75, I don't know if I could have been as focused as when I was answering the first 40 questions. So you really want to train your mind to be able to sit down. Now, why I say you should start at 25 questions and then work your way up is because you want to also, equally as important, okay, is read the rationale for every question, even if you got it correct, because the rationale is going to explain why that answer is the answer and why the other answers are not the answer. Because a lot of NCLEX questions, even though they're not worded the same, it's the same idea behind them. So once you can start getting used to why this answer is correct and why this answer isn't, you're going to understand the pattern of what the NCLEX is wanting from you. And what it wants from you is to use the nursing process. Okay? It wants you to use the nursing process. So here's my other tip. When you're answering your questions, you want to look at the question and see, did the nurse in this question already assess? If the nurse already assessed, is one of the answer choices something that she can do within her scope of practice? Or does she need an order for it? So she needs to call a provider. Okay. If she did not assess, then the answer is going to be an assessment. Okay. So think about the nursing process when you're answering the NCLEX questions. Think about, did I already assess enough to start performing interventions? So the next thing is prioritization, okay? So obviously you all already know about airway, breathing, circulation, so I'm not even gonna go there. But you also wanna prioritize acute versus chronic, okay? So when they give you 4 different types of patient, you wanna think about, okay, maybe all 4 of them have chronic illness, right? But one of them whose issue maybe isn't usually as dire is more dire because this is an acute problem, whereas the other ones are not acute at this moment. So for example, I have one patient who is admitted with diabetes. The sugar is now well under control, getting ready to be discharged. I have a chronic COPD patient who is currently on 2 liters, is sitting well, is comfortable, and is stable. I have a patient who is 22 years old and came in because he stepped in a nail that went to his bone and the foot is infected, right? And then I have some other kind of patient. So COPD is very important, right? Airway breathing, super important. Diabetes is also very important. But currently, who is the priority patient is the one who might be developing osteomyelitis, cellulitis, and an infection to the wound and could become septic, right? So that's what you want to just think about, acute versus chronic illness. Okay. All right. So those are my tips on how to prepare for the NCLEX. I hope this was helpful. And listen, when you go out there and you go to take your NCLEX, first of all, don't forget any of your stomach medication. So I had my Imodium, I had my Pepto, I had my Zantac, I had everything else, right? So don't forget that. Make sure that you eat breakfast, obviously. Make sure that you choose a location that you can get to safely and easily. Okay. And preferably if you have to drive somewhere, maybe someone can drive you. I chose to go into the city, so I took the train and I relaxed on the train. And I'll tell you what, you'll be surprised at how relaxed you feel on that day. I used to have really bad testing anxiety where I used to get sick, which is why I brought all my stomach stuff, right? But because I had studied so hard, because I had prepared so much, I really did feel at ease when I got to the site, okay? Take your time reading the questions. Don't worry about anyone. This is about you. This is your personal journey, and enjoy the ride, okay? Enjoy the ride. All right, guys, that's it for this episode of Shift Report, and I hope to be seeing you all very soon. Bye.